last 3 decades, there has been a startling increase in the prevalence of obesity and overweight in the United States. Our study found that in 2021, there were an estimated 208 million people living with overweight or obesity. The situation is especially severe in the southern states. If no action is taken, we projected that by 2050, over 260 million people will be experiencing overweight and obesity in the country. Obesity in the United States are driven by various factors, including lifestyle factors such as high calories diet and low physical activities. There are also multiple structural factors that are propelling the obesity epidemic. These include suboptimal urban planning with limited safe space for exercising, aggressive marketing from the food industry to promote unhealthy food deserts, where access to healthy food choices are very restricted. In addition, currently in the United States, the healthcare system do not provide adequate support for obesity prevention and treatments. People with low income are especially vulnerable to these risk factors. At the individual level, obesity increased risks of diseases such as diabetes, cardiovascular diseases, cancer, and shortening life expectancy. As many may recall during the COVID pandemic, patients with obesity were disproportionately affected with higher mortality rate. At the societal level, treatment and management of obesity is going to pose substantial pressure on the existing healthcare system. The economic cost of obesity is also stunning. A Congress report last year suggested that the healthcare costs associated with obesity will increase to $4.11 trillion in the next 10 years. And a Senate report earlier this year suggests that if half of the adult population with obesity were prescribed the latest medication, it will cost the healthcare system $411 billion each year. Obesity does not just affect individual health, it also has profound societal impact. The mechanism behind obesity epidemic in the United States are much more complex than simply energy imbalance. Existing interventions often emphasize lifestyle and behavioral changes have not produced significant impact. Addressing structural drivers of population obesity with an emphasis on prevention is going to be key for any future strategies. These may include increased subsidies for healthy food, regulating food marketing and nutritional content, enhancing healthcare access with better insurance coverage for obesity management, as well as modernizing urban planning with the inclusion of safe space for physical activities.